Hey, it's Dr. Wonder. I did some blood work and I actually did it on purpose, knowing I was going to go over my blood work with you. So if you're interested in seeing what a doctor's blood work looks like, or maybe you should ask your doctor what their blood work looks like to see if they should be helping you with their specific problem, because hopefully they don't have the problem that you're having. Anyway, the first thing I want to point out is on the right hand side. First of all, let me show you. Here's my name, and here's my birth date, and my age, and oh man, I'm getting old. Um, this blood work was done January 31st. It was done at LabCorp in Nashville. And the reason I bring that up is this right here where it says reference interval on the right. These are not normal values. These are reference intervals based on your geographic location and which lab you went to. So meaning if I'm in Nashville right now, currently, if I went to a different lab, if I went to Kaiser, if I went to Quest, if I went to any other lab, urgent care, the hospital, whatever, these numbers would be different because it's a statistical analysis of everyone who went to that lab who lives in that area, and it's just a statistical reference interval. Meaning if I would have went to LabCorp in Florida or in Texas or in Connecticut or in California, these numbers would be different. And the biggest problem with that is these numbers are very, very wide in range. I mean, you're going to see, I'll point one out when I get to one that's really wide, where what I use is called the functional range, which means this is where your body's functioning properly, right? Not being compared to a bunch of sick people going to get blood, right? And being compared to them. And the only reason you're going to see an H or an L bolded is because you're in the top 2.5 percentile too high or the top 2.5 percentile too low, and anything else, that 95%, they're going to say you're okay. That is 100% not true. That does not mean you're functioning properly. Okay, so here's the CBC. One of the things I want to point out that a lot of people don't realize is that this neutrophil to lymph ratio should be a 2-to-1 ratio. Meaning if my neutrophils are 58 and if it was perfect, then the lymphs would be 29. So it's pretty close, 2-to-1. That's a function of how is your immune system working, okay? Everything else looks good. You're going to see my glucose is 93. If you're diabetic, your glucose should be between 85 and 99. And how do we know if you're not diabetic? Like if you started off diabetic with us and then we were working towards the goal of reversing your diabetes, then this number should be between 85 and 99 and not on medication. So if you do blood work on someone who's not diabetic, that's what it looks like. If you do blood work and you want to become non-diabetic, that's what our goal is. These are kidney markers. They look good. The potassium looks good. Sodium, chloride, all that looks good. Calcium, good. Total protein is a little low. So functionally, this should be between 6.9 and 7.4. So I'm at 6.5, which means my stomach acids, my GI acids are a little low. So I need to increase those. So that's something that I'm going to do. But again, you won't see an L or bolded here because it's not pathologically low. It's just functionally low, meaning I'm not functioning as good as I could. Liver enzymes should be between 12 and 26. These first two are. My urinalysis looks good. My pH is 6.5. I'd like to see that at 7, which would make it perfectly neutral. But we're good. I don't have any protein, glucose, ketones, blood, etc. in there. My lipid panel, my cholesterol is good. We're looking for 150 to 200. By the way, I don't take any prescription drugs, zero. I'm not on anything. Now listen, if I needed to be, right, because of something that was going on, I would make sure that I really needed to be. I'd probably try to do some things to improve the marker so I wouldn't have to be on it. But basically, I'm not on anything right now. HDL looks good, 59. You don't want that too high. If it's too high, like I usually say, maybe like 75, 80 or higher, that would mean you have an autoimmune disease, usually. Whether you know it or not is not the point, but usually that's what that means. Now you're going to see I have 3 highs here, my LDL, my non-HDL. They're a little high, but listen, cholesterol gets a bad rep. We need cholesterol. Cholesterol is our mother hormone. And so I'm not concerned with these numbers at all, especially because my triglycerides, which is the sticky material in your blood vessels, this is 73. These should be less than 100. So it is. You see that. My LDL large P is borderline high. Now, I'm not concerned with this because I can't do anything about it because this mostly comes from your genetics. So I'm doing everything I can to make sure my lipid panel is normal, but I have no concerns on this whatsoever. My small LDLP is normal. My LDL size is normal, which is good. It's telling me my insulin resistance is slightly high. That's because of this large LDLP, which again is genetic, so I'm not concerned with that. Here's my thyroid panel. TSH looking good. T4 is actually a touch low. So T4 is actually the inactive form of thyroid hormone. That should be functionally between 6 and 12. So I have what's called an underconversion from my TSH to T4. T3 uptake is fine at 34. This should be between 28 and 38%. Free thyroxine index, good. Now I measured my hormones. I measured them because I knew I was going to do this video, but to really properly measure your hormones, it should not be in blood. It should be in a different form, which is measuring what you have the ability to use. So that's done either through saliva or dried urine test. But I knew I was going to be doing this video, so I figured I'd do it. And the explanation I usually tell people is, if you told me how much gas you have in your gas tank, and you say, hey, I got a half a tank of gas. And then I say, well, give me all the keys to the car, and I take all the keys to the car and I throw them in the ocean. Even though you have a half a tank of gas, currently right now, you can't use it because you don't have any keys. So when we're measuring hormones in blood, we're just measuring what is in the system, not what you can actually use. So you need to measure what you can actually use, which would be done in that saliva or dried urine test. So my total testosterone is good. My free testosterone is slightly low, 5.8. I'm not overly concerned with that because I've already measured this in the saliva and it's fine, but it is showing a little low here. My A1C is 5.3, so you don't want to be above 5.6. So anything 5.7 or above is diabetic. By the way, I know there's giving you a little chart here. It says pre-diabetes 5.7 to 6.4. Listen, there's no such thing as pre-diabetes or borderline diabetes. You either can regulate your blood sugar or you can't. That's like walking up to a woman who doesn't look pregnant and say, well, you must be pre-pregnant because you're either pre-pregnant or you're pregnant. No. So you're either pregnant or you're not. You can either regulate the blood sugar or you can't. So if you're doing blood work on a non-diabetic, the A1C should be 5.6 or lower and the blood sugar 85 to 99. And that's how we know when a diabetic patient is now moved into the non-diabetic range, because their numbers will be in this range. And the key is not on any blood sugar medication. Okay. This is a cancer antigen test, which I'm good. Now, this isn't a test you can definitively say, hey, you do or you don't have cancer, but it is a good general test for you to do. Again, use more hormones. DHEA is normal. Estradiol is normal. PSA, normal. Again, these estradiol and the DHEA, I did these because I knew I was going to be doing this video to show my blood work. My vitamin D is actually functionally low. So you see the reference interval says 30 to 100, which I fall in, but really functionally, this should be no lower than 65 or 70 to 100 is the range we're looking at. And it shouldn't be higher than 100. If it's higher than 100, that would be bad. So vitamin D is one of the vitamins, A, D, E, and K, that you don't want higher than the interval because it can cause some damage. So, but 32, I need to work on that. My C-reactive protein. Okay, so this is a test to run to see if you have risk for cardiovascular event. In English, cardiovascular event means heart attack or stroke. So obviously you want to be low risk, right? Which is less than 1. This is another reason why I'm not concerned with those LDLs being slightly high, because this is a much more accurate test of, am I going to have some form of an obvious issue, right? So you want this to be less than 1, and it is. Now I do have homocysteine. Okay, so look at this reference interval, 0 to 14.5. That's a really high, wide range of an interval, right? Homocysteine should be less than 7. And so I'm at 11.7, which I don't like, which means I have too much inflammation and or problems with B12 absorption. So I'm going to have to do some work on that. But again, if I was just looking for the bolded numbers, I wouldn't know that, right? So you got to look for the functioning, how is your body functioning? And obviously I'm not functioning at the highest level I need to be with this homocysteine being high. This is also a risk factor if you're diabetic to show, do you have increased risk for getting Alzheimer's, which is type 3 diabetes, okay? GGT, which is the third liver enzyme that's hardly ever done on people, 15. This should be between 12 and 26. Again, look at this reference interval, 0 to 65. That's way too high. So I'm good at 15. And insulin, I'm producing insulin at the proper amount, which I should be because I'm not diabetic. Okay, so I thought that would maybe be interesting for some of you. Hopefully it was. Let me know if you have any questions. Okay, let me know if you've ever seen any of your doctor's blood work and what do they have going on. Not that they need or have to show it to you, but I just thought it was interesting to go through mine.